All right, in your Health Watch this morning, with us once again, friend of the show, Dr. Syed Hussain from Trinity Health of New England. Today we are talking about COVID-19 testing. There are different things viewers want clarified. We're talking about boosters as well. He makes the complex simple, and that's why we invite him back week after week. Dr. Hussain, good to see you.
Thank you.
Let's get started. A lot of buzz having to do with this Moderna booster. Walk us through what it means, what folks at home should know.
Yeah, this is an important milestone, Keith, in our fight against this virus. It's a sharpened tool in our toolbox to fight this virus. So basically what this is the UK now is the first country that has given permission, given authorization to the Moderna reformulated vaccine, which acts against not only the first strain of COVID-19, but also the most dominant strain right now worldwide, which is Omicron. And Omicron has spawned, as you know, a number of subvariants. BA4, BA5 are doing the rounds, gaining ground in this country. But it positions the UK to be ready for a potential fall surge. And this is likely how COVID vaccines will look like in the future, where it becomes an annual vaccine. Moderna has applied for authorization for this reformulated shot in other countries as well, and we do expect the U.S. to approve it at some point next month or so.
A big development there, and just to clarify, I mean, you said it, this is not a 1-2 or done. You think these boosters are part of our routine moving forward?
It will be. Now, there is a difference, though, in terms of where the UK is and where we are in terms of vaccination progress. The UK, for instance, has over 76% of its population now fully vaccinated, with at least 60% that have received the first booster, which is quite different from where we are in the U.S., where less than 30% or so have received the booster dose, which means it adds more urgency and importance from a healthcare and public health perspective to educate folks when this reformulated shot is ready and available for use, that folks should roll up their sleeves and get the vaccine.
Doctor, let's talk about all this rapid testing. It is such a part of our lives now. You can get them at the grocery store. You can find them online. For folks at home who are saying, how effective are they specifically against these different types of variants? Do they all work the same way? Are they just as effective kind of no matter what variant we're talking about?
Short answer is yes. They are effective against the Delta variant, and they're also effective against the Omicron. Now, the FDA did issue revised guidance in terms of testing and how frequently you need to get tested if you're unvaccinated and not up to date with your vaccinations and you've been exposed to someone, you're asymptomatic. Then instead of 2 rapid at-home tests, you now need to do 3 tests, which are 48 hours apart, to increase the accuracy and to reduce the odds of a false negative.
We reported this morning and have followed over the last couple of days the CDC easing guidelines when it comes to sending kids back to school. That is right around the corner for us here in Connecticut. We will dedicate a whole week to it next week. But while we have you on the couch, what are parents being mindful of as kids of any age go back to school or back to a college campus? So
this is a huge positive because as we saw last year, school was disrupted and classrooms were disrupted. There was cohorting going on. There was, quarantine that children had to undergo, disrupting their normal school life. So that all will probably be put to an end with these new revised CDC guidelines as we learn to live and coexist with this virus.
Dr. Syed Hussain, always learn something new when you stop by the couch. Folks can look for you each and every week at this time right here on the Fox 61 Morning News. I'll give you an elbow as well. That's my deal this morning.